Thank you all for coming. We've been doing this program at a couple of the different senior centers throughout the past few months. So it's an educational program and looking at what your options are. As all caretakers, we might be caretakers for our family members or caretakers for ourselves or future caretakers. So it's good to know what your options are. And there are many options out there. So the more information you have, the better decisions you can make for yourself and your loved ones when that time arises. So representing today is myself, Lynn Alexandrowitz, and I represent Shrewsbury Nursing and Rehab, which is in Shrewsbury, family-owned still. And I also represent a private home care agency owned by a nurse called Accessible Home Care. And then we have Patty to my right. Patty is from Notre Dame, and they have all different divisions, and she'll be talking about the hospice. And then we have Sharon, who works for Fallon Summit, talking about what the PACE program is. And then we have Melissa Badario, who represents Orchard Grove Assisted Living, which is in Shrewsbury also on Walnut Street. So she'll be talking about what options are, what assisted living is and independent living is, and do people have memory units and what have you. So we'll kind of give you a quick overview of what the availability and what your options are out there, and ask questions as we speak. Please feel free. So I'm going to start off with what regarding home care is. So everybody has heard the term home care. There are two facets of home care. One is paid for by insurances, and that's usually a Medicare certified home care agency. So they work with Medicare and get reimbursed by Medicare for your care. And with that, there are probably about 400 something Medicare certified home care agencies just in the state of Massachusetts alone. And what would happen, I'll use the scenario. Let's say that you fell, you broke your hip, you had to go to the hospital, you had surgery. They're going to discharge you home, and you might have options to either go to a nursing center for rehab and then go home, or go from the hospital to home. So we'll use the scenario going from the hospital to home. Once you are being discharged from the hospital, and they say to you on a Thursday afternoon, "We're going to send you home, Mrs. Smith, on Friday afternoon." And you go, "What?" As a caretaker. And then you say, "Well, what are my options?" So you would probably look at a Medicare certified home care agency in the state. There are many to choose from, as I said, and they would provide services for you. So they would provide nursing services, they would provide, have physical therapy, occupational therapy, and if you had, let's say a stroke versus a hip replacement or a hip fracture, they would also have a speech therapist that would come into your home, and that home could be living with your loved one, living by yourself, living in an assisted living, what have you. It's wherever your home is. So they would come into your home and provide services as well as nursing services, and that would be based on what your insurance is, what your clinical growth will be, and that could be anywhere from 1 week to 8 weeks, depending on what your clinicals are and what you have for insurance. And then they might send an aide in maybe once or twice a week for an hour or two, and they can help with your activities of daily living, which would be showering, toiletring, dressing, that type of thing. They can do some light housekeeping. So that's what a Medicare certified home care agency is. And Medicare would pay for those services. So you would not have any out-of-pocket charges normally. It depends on the severity of your situation and what you have for insurance. It's insurance driven. So, but minimal, usually it's a week. I've seen it extend for a couple weeks. The other option out there is private home care agencies. And there are a couple hundred in the state also. I represent Accessible Home Care, which is located in Auburn. We're female-owned, and we are co-owned by an RN, which is nice, so we have a nurse that oversees everything. And what would happen is we could come in and help you. That would be, cost would be out of pocket, so you would have to pay for those costs. And we can do, and with private home care, they do anywhere from live-ins, which means an aide would actually come to your home and live at your home and take care of you 24 hours, 7 days a week. Or you could do what they call 12-hour shifts, so 12-24, which means that you would have aides that would come in and work 12 hours and be there the full time awake for 12 hours. And they would be able to come in and help you with your activities of daily living. Again, the acronym is ADLs, and that would help you with your toiletry, your dressing, your showering, your light housekeeping, meal preparations, driving you maybe to follow-up physician's appointments or to CVS or to Stop and Shop, if you needed to run errands. With private home care agencies, you can leave the home and go out into the community. With a Medicare certified home care agency, Medicare requires that you stay within your home. So if you're receiving services from Medicare, you cannot just say, oh, I want to go out to the supermarket or I want to go out here. Unless it's a physician-directed appointment, you really have to be in your home. So those are kind of the two differences. And with private home care agencies, one thing that I do recommend is to really look at, do they do a national CORI check, which means it's a criminal background check. And nationally would mean, especially where we're on the border of so many different states, if someone had a bad record in, let's say, Rhode Island, they could cross the border in 20 minutes and work in Massachusetts. If you're just checking Massachusetts-based criminal background checks, you're not going to know that they're not supposed to be able to work in Massachusetts. If you do a national background check, we would know that you are not be able to work in Massachusetts because something happened in the Rhode Island marketplace. So you want to make sure the questions to ask are, are you insured? Are you bonded? Are you, how do you do your criminal background checks? And most of your home care agencies have RNs, LPNs, physical therapists, occupational therapists, CNAs, so certified nursing assistants, and home health aides, certified home health aides. And then they have what they call companion care, which sometimes is just a safety sitting measure. So let's say someone has dementia and you're the caretaker and you need some respite time, and that loved one with the diagnosis of dementia has a tendency to want to go outside and wander. So safety sitting would be staying there with the client, making sure that they're safe while you're running your errands, that type of thing. So from home care, they can do everything from medical to safety sitting. And there's so many out there, but really look at the surveys, talk with people, talk with Renee, see who, she would recommend. It's very important. Talk with your friends, your family members, see who they've used in the past, and look at your options, because you do have options. And one thing I want to note, when you are in the nursing hospital situation and they're going to be discharging you, you do have options of where you can go and who you want to use. So let's say your granddaughter works for, Accessible Home Care. You want to use Accessible. And they say, no, we want you to use the ABC company. You can say, no, I have my options. So you do have options to choose. And you also have options to choose when you're in a nursing home. If they're going to be sending you to a nursing home and you're in the hospital situation, you have options to say, I want to go to this nursing center. They might not have a bed available, but you do have that option to choose. So always remember to speak with your case manager or your social worker within the hospital environment. Someone is assigned to you for your care, and ask them, say, these are my options. I want you to look at the ABC nursing home. I want you to look at these home care agencies. I want to, look at this hospice. I might be interested in the PACE program. And they reach out to us, and we can come in and meet you. Now we're open with the changes of May 12th. We're able to go back into the hospitals. So we can actually come into the hospital and meet you at the hospital and discuss options with you. So please keep that in mind. Yes?
Yeah, just a question on if that should happen and the person you feel as though needs more memory care.
Mm-hmm.
Is that something you would be able to help with too?
Yes. So a lot of us are certified dementia practitioners also, and a lot of our organizations, a lot of our staff are certified dementia practitioners. So we work with dementia and Alzheimer's. So, and both us, just as I said, we lost our moms, and they both died from the diagnosis of Alzheimer's and other situations, but the primary diagnosis was Alzheimer's. So, we've lived it. Unfortunately, professionally and personally as caregivers and daughters too, and then as professionals. So, But that's something a lot of people don't focus on it, but a lot of people do focus on it. So that's something, a question to ask when you're researching what your options are too.
So
Yeah.
if I could add something,
Mm-hmm.
sometimes I get calls from residents who say, gee, my mother's being discharged from the hospital and they're kind of in a panic. And a lot of times they don't realize that they have a case manager at the hospital.
Mhm.
And you should always be in touch with that case manager to discuss discharge planning.
Mhm.
So that you can know, potentially approximately when your loved one is gonna be discharged and start looking for places for placement if that's needed.
Mhm.
So that's one thing. And the second thing is, there's one place where you can start your research, and that is the Home Care Alliance of Massachusetts. Their website, thinkhomecare.org, has Medicare certified agencies and other agencies that have additional certifications to the Medicare. So all you have to do is do a search by the town, and you would get, and also by the type of care needed, and it would bring up town agencies that serve Shrewsbury, and you can kind of start the ball rolling from there if you don't know of one that would be recommended or whatever. It's a good place to start.
Mhm. And again, all the organizations have websites. You can go from assisted living organizations, Massachusetts Assisted Living Federation. The nursing homes have an organization that you can go and look on their websites and look to see what a rating is. Hospice also has that. I'm not sure about the PACE program, the PACE too. And so you can get a lot of that information from, I like to refer to it as, Dr. Google. So can help you a lot, so.
And on the point of what she said too, just one final thing, and that goes for regardless of what the outcome is going to be, is that case manager and social worker, they are, how the state of hospitals right now, it's very, very difficult to actually find that person and get that person's attention. But they have to, as a hospital, they have to make sure it's a safe discharge.
100%.
If you feel it's unsafe and you cannot accommodate what they're gonna send them home and you don't feel you can accommodate that, or at least you can't get everything in place fast enough for the date, they cannot send that person home against your will. So you do have the right to say, no, hold off, I can't do this right this second, I need time to get an agency in place, I need to call my family to see if they'll come and help me, or my kids, or what have you. So you do have that right. I mean, granted, you've got a limited amount of time, they can't stay there for weeks and all of that, but you have to make sure it's safe, and if you don't feel comfortable, you are allowed to put the brakes on.
Great.
I did have a situation probably about 3 years ago, and we wanted him discharged to rehab, and this case worker was wonderful, but she couldn't find a bed. She couldn't find us a bed.
Was this during COVID or pre-COVID?
It was pre-COVID.
Pre-COVID, yeah.
And anyway, so finally they said, well, we'll do physical therapy in a day or two. And then the physical therapist discharged him. And it was scary for me.
Yeah.
It was scary.
It is, yeah. You can't actually be discharged from the hospital until physical therapy discharges you. That's the waiting piece when people are ready to go home and,
But to your point,
right,
I
yeah.
have been in that where, 3 days, and they say, we're done,
Right,
because they
yeah.
can't, they're not gonna have anything to show improvement. And again, it depends on what's wrong too. If it was severe versus something that they consider not severe or whatever. So yeah, there.
Also are not nurses or
Yeah.
Right.
Yeah.
TAs.
Right,
I mean,
right.
it's not natural to us to be able to take.
But again, everyone's assigned a case manager and a social worker within a hospital environment. That person may change daily, which is not unusual. Yes, you might have Mary today and
That's happened.
Martha tomorrow. So, but, be an advocate. If you can't advocate for yourself, have your family member advocate for you, or whoever you chose as a healthcare proxy, have them advocate for you if you can't make your own decisions at the time, so. But at this point in time, we're going to move on to our next speaker, which will be Sharon from the PACE, Fallon PACE Summit Program. And PACE is a national program that she'll talk about. Hello.
We're glad to be here, ladies and gentlemen. There is a gentleman. So I'm Sharon Noley, and I actually live in the town of Shrewsbury. I've lived in this town for many, many years, since I was just a kid. I'm glad to be here. I've been in the elder care industry for about 25-plus years now, and I work for Fallon Health, and I work for the Summit Elder Care Program. The Summit Elder Care Program is a PACE program, and I gave you your brochure. It's orange, I think, or the orange brochure is the Summit Elder Care brochure. So these PACE programs are throughout the United States. Not every state has a PACE program. In Massachusetts alone, there's 8 of these programs, and we are the largest PACE program in New England. And we've been around for almost 30 years. Has anybody heard of us before? Okay. So Summit Elder Care is a PACE program, and we're one of the 8 PACE programs. What are these PACE programs? It stands for Program of All-Inclusive Care for the Elderly. And basically, we have a team of experts, and they're geriatric. They work with geriatrics. So we have primary care doctors, we have nurse practitioners who can really look at the person and then help them along with social workers and a dietitian. The dietitian works with every family or elder and makes sure they're on the right track. We have physical, occupational, and speech therapy, and most of all, we also have an adult day health. So at the adult day health, people can go and see their doctor and nurse or a therapist. They can sit down with their social worker. They can go for activities, fun, music, outdoor activities. We also walk, and we do a lot of exercise. Now, the nearest location to Shrewsbury is 288 Grove Street, and that's our latest. It's a brand new building, and we've been there for about a couple of years now. So that would be the place where if anybody lived in Shrewsbury or surrounding towns, they would go there for the adult day health. Many people say to me, well, Sharon, I'm interested in this program, but do I have to be a Fallon member? So people change their insurance, because it is an insurance. They change their insurance to Fallon Health Summit Elder Care. Some people say, well, I already have Fallon Health, but there's many different programs under Fallon. There's Fallon Senior Plan, Navicare, there's Summit Elder Care. So they change their insurance to the Summit Elder Care. And they can enroll at the first of the month. It's always the first of the month. It's not like when there's certain times of enrollment. The reason is because the individuals who belong to this PACE program they're needing help. They need nursing home level of care. So you might say to me, Sharon, who's eligible? In order to be eligible for Summit, you need to be 55 years or older and nursing home certifiable. So that means that you have ADLs, like Lynn talked about, activities of daily living that are activities that you would need help like in a nursing home. In other words, medication management is one of them. Help with Alzheimer's, having behavioral health issues. That could be a type of nursing home ADL. So in order to qualify, you need to have 3 ADLs and be nursing home certifiable. Gets a little bit involved, and I can sit down with you after if you have any questions about that. So you'd have to be living in the service area, and we cover most of Massachusetts, not the Cape, not so much the Berkshires, but we do cover a large part of the state. We're in Springfield, we're in Webster, Worcester, like I mentioned. We're also in Lowell and Leominster. So we kind of split it up, and depending on which location is closer. We also provide transportation, 2 medical appointments, and transportation back and forth to Summit. Some people really don't want the adult day health, but they really need more care in the home. So we also provide in-home services. That is included. Because some people really need to be taken care of only at home. We design a care plan that's designed just for that particular person. It includes how many hours of home care a week, what are the ailments, who are the physicians, and many times people are able to keep their specialty doctors. So the care plan really does get more involved, and people may call me and say, well, Sharon, I want 40 hours a week. So we have to really look at the whole situation. The social worker and nurse go to the home, and they look at the situation and discuss what is it that you need from us. Because truthfully, sometimes families are there and they're doing a lot and they want to keep it that way. Sometimes families are not there, so those individuals may need more care. Trying to think if I forgot anything else, but we do nutrition evaluations, so if people are dealing with diabetes or possibly overweight or not eating enough, you know, the dietitian really works closely with, sometimes it's the family and sometimes it's the elder. At the Adult Day Health, we have two sections. One section is really for more severe Alzheimer's and dementia, and it's just a little bit quieter, there's more hands-on. And then we have another section for people who might have some memory loss or more of a physical disabilities.
If they went to the locations that you mentioned.
Yes.
Is it Monday through Friday, and do meals are included too, or?
Yeah, thank you, Zen.
You're welcome.
It's Monday through Friday, and we do include meals, and of course, if anybody has any medications, but that is included. And of course, the transportation. So if somebody is going into Summit Elder Care or even for a medical appointment, the van driver goes in the home and makes sure the person is safe and helps that person out of the home so that they can be assisted. It's a wheelchair van. They're assisted in and out of doctor's appointments and in and out of the Adult Day Health. And you're welcome to take a tour if you'd ever be interested. And my telephone number, I will make sure that, I'll just say what it is, but it's 774-232-0412.
Is, in the healthcare, it's really changing. You know, it's like you go to a building one day, you flood, and then you go back to the same building to collect the whatever they need to read off of it. But it's never. It seems like it went down. It's never the same. It's all over the place.
Healthcare is forever changing, and I think where we are in Massachusetts, we have probably some of the best healthcare in the country. We're lucky that we're not in the Midwest where you have to drive 3 hours to get to, you know, an ER or a hospital or a physician. We have such great hospitals and choices in this marketplace. And again, so many options. A lot of the options that we're speaking about today are not in every state either. So nice being in Massachusetts and having options and being able to make your own choices.
And then just in answer to your question with the PACE program, you know, everything in a sense is right in one place except for the specialists. So it makes it easier for the family because we'll case manage, make sure you get to the doctors, make sure you have your doctor's appointments, make sure you're feeling okay when we see you. So it's a little bit easier for the family and for the elder because it's under one roof. All of it is under one roof. And I did forget to say, of course, the most important thing is that it can be at no cost. Mass Health and Medicare do pay for this program, or it could be a cost depending on assets and income.
So would they do a sliding scale? Say I had a little bit of money, but not a lot, and I did the insurance, would that be something that they would look at?
Yes, they do look at what the assets are for the person and the income. It does get a little bit involved. Yep.
Questions that you have for Sharon? And again, if you have questions privately afterwards, feel free, you know, to approach us. So I'm going to be speaking again. I wear multiple hats. I'm a good multitasker. So I'm also representing Shrewsbury Nursing Center, which is one of the family-owned, still family-owned, which is highly unusual in this market area. There's about 375 nursing homes in the state left. There are a lot of nursing homes that have closed their doors. I'm sure you've heard about them on the news or read about them in the newspaper. And a lot of them are being acquired by national companies that are not from the Massachusetts marketplace. I must say that Shrewsbury Nursing Center is still owned by a family, the Flanagans, which are based in Shrewsbury, and we're celebrating our 70th year. So with nursing homes, again, there's about 375 in the state, and Renee was talking about going online and looking. So there's a rating system with nursing homes across the state. And it goes from 1 to 5. 1 is not the best. 5 is the best. 5 stars is the best. 1 star is the worst. So when you're looking, you can go on .gov and you can pull up the latest surveys. We're all surveyed. Once a year, they come in. The state comes in with a team, and they can be there for 5 days in a row for, 12, 13 hours a day, and they go through everything. So everybody has a state survey that's done, and always the results are kept in the lobby of every nursing home, and you can go online and also see how they were rated regarding food, hygiene, clinical, nursing, from housekeeping up to clinical. So there is a rating system. Again, 5 stars is the best. I know somebody came to me.
Especially the number of nurses to patients.
Right, your ratio, sure. So also in the
And
lobby,
aides.
yep, in the lobby of a nursing home, every day it's posted, and they will show you which shift, what the nurses are and the aides are to what your staffing is to what your, how many people that you have in the building that day. So that's always posted when you first walk into a nursing center. So as I said, nursing centers, there's many of them in the state. You have your choice. Most of them accept most of the insurances, Medicare, your managed care, Mass Health, or Medicaid, whatever terminology you want to use. So again, I'll go to the scenario that you're in the hospital, you had a hip fracture, you had some surgery. This time you're not going to go home right away. They're recommending that you go. You might live by yourself and you don't have family to help out, so they recommend that you go into a nursing center. And that nursing center, you could be there for short term, and that usually is anywhere from 2 weeks to, 3-4 weeks, depending on the severity of whatever your injury was or your diagnosis was. And how that's paid for is your Medicare would pay for days 0 to 21, and they pay at 100%. So there's no cost for you when you're in a nursing center. Days 20, 22 up to 100, there is a copay charge. And if you have a secondary insurance, so let's say you have Medicare and you might have Mass Health or Medicaid. Medicaid would pay that days of 21, 22 to 100 days. And then if you're over that 100 days, then you would have to look to see what other insurances are available or what the cost would be. If you went into a nursing center and you only had Medicare, and that coverage only paid to day 21, and you had to go past day 21, there would be a copay charge for you, and that's usually a couple $100 per day. And that's a set across, nursing homes do not set that rule, that's a Medicare set rule. So, just so you know. So most nursing homes offer short-term care, and that would be, again, anywhere from a week to a couple weeks, depending on what your severity of your injury might have been and your rehab. So in a nursing home setting, usually in Massachusetts now, there's a state rule. So at one time, as you know, a lot of nursing homes had 3 to 4 beds in one room. So now it's only a private room or a semi-private room in the state. And a lot of them have short-term, long-term, memory. So you want to see if somebody is being placed in a memory unit, if it's a secured unit, if it's not a secured unit, what are your options? Are they going in with the regular clients that are in the nursing center, or are they in a specialty unit to focus on whatever their diagnosis is of dementia or Alzheimer's? And then there's a term, has everybody heard of respite? So with vacation season coming up, sometimes you as a caretaker definitely need to take care of yourself and go away and regroup and regenerate yourself. And you could put your loved one into a nursing setting for a respite stay, and that could be sometimes 3 days, 7 days, depending, and that you know that they would be cared for, so their medication, their meals, their therapy, their nursing would be, and if they need a PT or OT or speech, would be taken care of too. A lot of the nursing centers also have outpatient centers now, so if you go there for rehab for your hip replacement or hip fracture, you can then continue as you get discharged home, you could continue to go to the nursing center in an outpatient setting and receive your physical therapy, occupational therapy, or speech therapy if needed. So that's something to look at also, because you already know that physical therapist, so it's nice that you can just transition when it's time for you to go outpatient, you would have the same physical therapist, which is important. So again, many nursing homes, what I recommend, and I know Melissa will probably recommend this from the assisted living when she talks in a minute, but I recommend that to look at nursing centers. Now that we don't have to wear masks, you can actually go in and tour the nursing center. Choose 3. Look at 3 in the area let's say, you know, your mother is in the hospital and she's gonna be discharged, you know that she's gonna be discharged in a week, they recommend going into a nursing center for short-term care. So start looking at the nursing centers that are out there and choose 3. Don't make an appointment, just show up at the door and say, I'd like a tour. So, you know, go at different times, you know, you can look at the sights, the smells, the sounds, look at the activities going on, look at the state survey, go online, look at, you know, with their star rating. So much goes into that versus, again, you have options. So if, you know, Mary, the case manager at the hospital says, your mom's gonna go to the ABC nursing center, you can say, no, I don't think so. I would like her to have these choices. And they might not have a bed available, that does happen, but if they do, those are your choices and options that you can go as long as they take your insurance that you have and there is a bed availability. The years of, we used to hear, oh, there's a wait list, those days are pretty much have gone by the wayside. So usually everybody has some availability. It might not be a male bed. You might have to wait 2 days for a male bed or whatever. But again, look at your options and be an advocate in your choices when you're looking at nursing centers. And look at your star rating, talk to people who have been there. You know, I think it's important when you look at, there's about maybe 3 family-owned nursing centers in the state still. That's it. And everybody else is owned by corporate America owns a nursing center, so. And a lot of them are closing. There's probably in the past 2 or 3 years, I would say probably about 100 have closed in Massachusetts alone.
easily.
Yeah, if not more. So,
Lynn, unfortunately, don't be surprised if all the good ones, the beds are taken. Which, you know, happened to my mom a number of times. And they were discharging her, we had to place her, and went into a rehab that, you know, it had 3 stars, it wasn't ideal, and it just turned out to be.
it's unfortunate.
She went home with bed sores and
Oh.
everything else. We just didn't have a choice, and sometimes.
Right. And during COVID, Renee, it was very difficult because there are a lot of times that nursing homes were not taking positive COVID patients. So they were coming, they might have went to the hospital for a hip replacement, caught COVID at the hospital, testing positive. They had to go to a nursing center, but nursing centers were not at that point in time taking positive patients. So that did change as, you know, we went into like year 2, 2.5 of COVID, where we lived for 3 years of it. But that did change, but for a while it was very difficult for placement for loved ones. And people were being kept in the hospital because nursing centers were closed to admissions. Yeah, yeah. So, but right now, I know in this marketplace, there is bed availability for all nursing centers. Yes?
Yeah, I mean, looking at something like that, what is like the most important thing? Is the nurse to patient ratio like right up there? I mean,
The most important thing, I would look at the star rating.
yeah.
Yeah, start with that, and then your ratio changes every day. They're based on your census. So let's say there's 100 beds, and you might have 10 beds open. So today's census is 90. So your ratio is going to change. It's not based on 100 beds. It's based on those 90 beds that are full. So each nursing center, the ratio changes daily. So I think most important would be looking at the star rating, looking to see if they're corporately owned or if they're private owned. Talk with some family and friends in the marketplace and go for a tour. Go and check it out, look to see, find out who their medical director is, who the association is.
I think that's important too.
Very.
A lot of people don't realize they have their own doctors in
Right.
these buildings, and so understanding who that doctor is,
Mm-hmm.
if you can get in front of that doctor right away
Mm-hmm.
and establish, a rapport, that's very, very helpful. Because that is something you don't even think about.
Mm-hmm. Right.
You're still in the world of the PCP and whatever, specialists, and
Mm-hmm. As
it's
soon
just
as you go into a
whirlwind.
nursing center, that primary care is not taking care of you. It's the medical director that's associated with that nursing center. At Shrewsbury, we happen to have Dr. Sheik, who is a geriatrician, a wonderful, wonderful physician, a geriatrician, and it's part of UMass medical team. So, which is.
And that is something, and if I weren't in the industry, I would never know this,
Mm-hmm.
but you'll have a medical director that has 25 nursing homes. How can you possibly be able to
Mm-hmm. Right.
really
Right.
you know, be available.
And
So
they'll have nursing practitioners that go
so
in with
it's-
them.
There are some things, you know,
Right.
and again, all of this is just to say there's actually information around these things, and sooner, instead of kind of not doing it or, you know,
panicking.
panicking, you know, if you just know a little bit going, you know, a little bit
Right.
of homework helps, then you're not quite as, because nobody has the time, like this gentleman said in healthcare, to really
Right.
sit and have these long, in-depth educational meetings with you. So it's kind of like, they've got to get you in and out, in and out. There's a lot of people waiting for that bed in the hospital.
Right.
Their job is to empty the bed and get on to the next, not to, you know, so, it's definitely good to just know a few things, you know, and understand when you get to say no or yes or, you know, like that, so. And to her point, it doesn't always work out. Maybe the bed isn't available where
Right.
you really want. So there,
Right.
I mean, it's not always gonna be.
So you choose three,
know,
that's what I said.
but-
So your primary would be, you know, Shrewsbury. Your secondary would be another nursing center in Worcester or whatever, you know.
Notre Dame.
Yeah, Notre Dame, actually. You know, during the COVID crisis, people were, if there was an availability not in the Worcester area, you might have had to go to Boston or South Shore and North Shore because there were no beds, you know, people were closed to admissions when COVID was at its height, unfortunately. So again, that is now looking different. The landscape has changed. Thank you, Lord. And as of May 12th, most of the assisted livings, the nursing centers, what have you in this marketplace are now mask-free. So again, you know, we all know now that, you know, I was laughing this morning, I was on a Zoom call and I said, lipstick revenue has gone up again because no one wore lipstick for 3 years, right? And we were having at Shrewsbury, we were having a burning the mask party.
Oh, yeah.
You know, yeah, so we, but, you know, we wanted to keep everybody healthy and what have you, so, which was important. So, again, to answer you, I would say I'd look at what the star rating is. I would choose 3 nursing centers, go on tours, ask particular questions. You know, what's the nursing ratio? You know, how was your state survey? Can I see the results of your state survey? You know, and I would watch the interaction of the nursing staff with the patients and see, and you know, if I could just do a little sideline, my mom was at a nursing center at Shrewsbury in the memory unit for 2.5 years. She lived to be 95. I had her a long time in my life. And my dad, they don't make men like him anymore. They just celebrated their 71st wedding anniversary. He was so dedicated, and he would go every day to the nursing center. And he would be there at 10 o'clock till like 2:30, 3 o'clock. One day, he had to go to the dentist, and it coincided with the 10 o'clock arrival. They were actually, 2 of the staff members called me directly and asked, is your dad okay? Because he's not here and it's 10 o'clock. I was just amazed at that. You don't see that everywhere. So I think very important when you're looking at nursing centers, looking at the staff interaction with the patients and the clients and the family members that are there. You know, see, you know, observe, you know, look at use the smells, the sights, the sounds, as well as, you know, their surveys and what their bed availability is. Did that answer your question? Okay. I'm sorry, no, I'm sorry, go ahead.
Are they upgrading every year or every summer or?
What's that?
They're rated.
They're rated, it's an annual rating, and that survey, they can come in, you know, during COVID, unfortunately, they were kind of behind, the state surveyors were behind. So right now, I know our window's open in Shrewsbury, so they could be here anytime from now to whatever. They can walk in on a Sunday morning at 7 o'clock in the morning and start their survey then. So, they're state employees, they work for the state of Massachusetts. And they're all usually have been administrators or director of nurses in the nursing home industry for many years to get to that point to become a state surveyor. So they can walk in anytime, but it's annually. So it could be June 1st, so next year your window's open between, you know, May and June that they can walk through the door, and they come in unannounced. Yes.
I
So.
worked with them when I worked at Children's Hospital.
Mm-hmm. Yeah. Yeah.
It could be.
You would have to go at the hospitals, you have to go through the CARF rating system, and they would show up at whatever time they chose and start their survey. And again, it can be, if everything's in order, And you hope it is, that they could be there 2-3 days, they could be there 7 days. It depends, then sometimes they come in with a parade, it's like 10 of them walk through the door, and you're like, okay, all hands on deck, you know?
The first time working there, they came over with the 10-week plan, or whatever it was, and they went through everything.
Mm-hmm, they do.
And I was working in radiology.
Mm-hmm,
That everything in radiology was connected. So if you had an MRI or
mm-hmm,
scanner, all that stuff would be under one. So if you wanted to get information, it was like you'd be calling all over the place and not getting the information that you want, and that's frustrating.
mm-hmm, yeah.
Fortunately, I've been out of there for a while.
Well, we thank
But
you for your
know-
service.
You know the hospital, you know the healthcare industry
Right,
then, it's
right.
tricky.
Questions that you might have regarding nursing homes at this point in time? Yeah.
I just have one question, if you could talk a little bit about hospice?
She is going to talk about hospice. We're kind of going in order of, you'd start with home care, you know, the kind of scenario, you would start with home care, then the PACE program, then you might go to a nursing center, and then assisted living, which Melissa's going to talk about, and then we're going to end with hospice, because that's kind of the general direction.
Unfortunately,
Yeah.
that was the end.
Yeah. So at this point in time, I'm going to turn it over to Melissa Badario, who is another Shrewsbury girl, originally, right?
Yep, so my name is Melissa. I work for the residents at Orchard Grove. We are an independent, assisted, and memory care living community. I did grow up in Shrewsbury, so graduated from the old Shrewsbury High over on Oak Street, not to date myself. So it's very nice to be back, as my friends would say, in the hood. So I don't know if any of you are familiar with us. We're probably the newer kid in town. We've been open for about 5 years. And I always like to start with what we are not. We are not about taking things and independence away from our seniors. Our goal is to keep you as independent as possible and to give the best life back to you. So a scenario for us that we want to keep you out of the rehabs and the hospitals and all that by keeping you healthier, by having great meals and being able to support where things are becoming harder to manage. So when we're at home, here's a scenario, and we're a little more isolated, some of our friends have passed, we're not driving anymore, we're not eating as well. Life is meant to be lived with people, with friends, in a community, with your peers that are looking out for you. That's what we provide. We provide beautiful apartment living where you have your own private space with wonderful meals cooked by our culinary team, engagements every day that you can choose to do. Nobody's gonna force you, but you have the options. And I don't know about you, whatever age you are, options are a great thing. To say, yes, I'd like to, no, I wouldn't. If you're not driving anymore, we provide transportation. We partner with the senior center here. They send their van over all the time. I still have residents that go to the gym and love to lift. I have other residents that like to go shopping or they have appointments. So we definitely are a community that is about keeping you as independent as possible, and where things become harder to manage, we can support you. We have a culinary team that is to die for. 3 meals a day are included. It's open dining, just like you're going to a restaurant every day. We have happy hour every day at 3 o'clock, so whether you're a drinker or not a drinker, it's a great time to socialize, to come down, see your friends, and maybe doing something that's going on. We have painting classes from a local artist. We have dancers come in. We have singers come in. We have a lot of residents from the community that live there. It's a wonderful, wonderful place. And our goal is to keep you healthy. And when we're at home and it's not the safest place, stairs are becoming harder, we're not driving anymore, there are other solutions for you. And I see it all the time. I've been doing this for about 12 years. People think that we're gonna be taking things away. That's not it at all. We wanna have you live your life as you always did without having to call somebody to go get your prescriptions, to have to call somebody to go to the grocery store, to have to call somebody because you're out of this, you're out of that. We're gonna make sure that you're able to do these things on your own while still getting support that you need and living a great life with other people, with friends and neighbors that are looking out for you. And it's beautiful, beautiful, beautiful. I did leave flyers over there. We are having a cookout on June 15th. It is open to the public. We call it our Burgers and Brews celebration. It's outside on our back patio. We do have a steel drum band that comes. We did it last year, so this is our second annual Burgers and Brews. And if you haven't been to the community, we invite you to come and see what it's all about. And as Lynn would say, seeing is believing. So you should go. And maybe you're not ready today or tomorrow, but go look at 3. It can be overwhelming. And go visit, see what they're about. Every community is a little bit different, but you will know when it's right for you, because it's that feeling. Look at the residents. Look at the people you're gonna, are they happy? Is the staff happy? You know, look at the community itself. Do they reinvest in it? Are the flowers beautiful? Have lunch there. Those things matter. So that's what I do. I'd love for you to come by and pay me a visit. Doesn't matter if you're looking or you just want to see what we're all about. That's what we do. So.
And
thank
their
you. If
lunches
anybody has
are
any questions.
fabulous.
Yeah, they are very good. We just
I
had
can all
lobster
attest to
rolls
that.
yesterday.
They're really
so
good.
They were good. But the food at this cookout is phenomenal. So if you haven't been, it's a great time. And it really showcases the residents that live there. So,
Do they need to call to go?
Yeah, RSVP.
well, there's an RSVP number right on
Okay.
there. Yep.
Yeah, can you
You're
explain
really
that?
an independent living for whomever, for
So we are,
like, there's not a transition?
yes,
of-
there is.
Oh, okay.
So a traditional independent community, somebody like a Southgate or the Willows of Westboro, they have independent living, and then when you need some assistance, you'll transition into their assisted living. We're a little bit different in the fact that you can move into us totally independent. We provide all your meals, and let's say you're with us for 6 months, a year, and things are becoming a little bit harder. We may be forgetting medications, or we have fall, we're a little bit unsure of the showers. You can stay right where you move in and go on to the assisted plan.
So you have, say there's memory issues.
And we have a memory care
So
community
there's-
too.
there's an
Yes.
opportunity.
They have a
Yes.
fabulous
So
memory
we have
care.
that
They do.
continuum of care right in one building. Our second and third floors are independent and assisted living, and you can go back and forth in the same apartment. But if you should go along your journey with Alzheimer's, and now you're needing a more secure community, a more supportive community, our Reflections neighborhood is on the first floor, and that is our memory care neighborhood. It's smaller, it's more person-centered, and again, it's about keeping our residents with Alzheimer's or dementia successful and purposeful in everything that they do. But you don't have to move. So it's very nice. And the best thing that we can do when we see those little things kind of creeping in that maybe we're having some memory loss is that engagement piece. So communities like ours can help to keep you more steady for longer rather than wait and remain isolated. So, but when that time comes, we are able to support that need as well.
What if the person you know needs memory care right off the bat?
They can come right into our memory care neighborhood. So we have that a lot, and we've seen that a lot after the pandemic. You know, the isolation on seniors was not good. So we have found that a lot of people that come to us, families call us, they may need memory care right away, and residents can move right into memory care as well.
And we work all as resources with
We
each
do.
other, so, you know, we have some clients and residents that reside at Melissa's community, and they went to the hospital, and now they're coming to Shrewsbury Nursing Center for short-term. And then we get them back to their baseline, and then they go back to the assisted living. So we all work as resources for
We do.
each other. And,
do.
you know, please, our cards are up there if you have questions.
Right.
Always call us, and we might not be the person for you, but we will get you who you need to speak to.
Correct. And we've worked together, and a lot
Okay.
of my residents have been on Notre Dame Hospice, or they've been over at Shrewsbury Nursing Rehab, or with Accessible. So that's why we're here together, because we can speak for each other, because we know
The
work and what
quality
we
Yeah,
can
of each
provide.
other's,
Quality's
yeah.
You know, it
important.
means a lot.
Melissa, can you talk about the financial piece of assisted living?
Yes. So our assisted living community is all private pay. So we are a place where if somebody has maybe a home to sell, they have savings, that while they're doing that spend down prior to going on to Mass Health, that's where they would go, is to a community like ours, and they would spend down. It's a lot less money than if you're paying privately at a nursing home or long-term care. So sometimes that's a better option if we can provide that care, which usually we can. So we are all private pay when it comes to that. And we don't have any requirements in our community that you have to be there 2 years, 3 years. We don't have that. But we do just wanna, we want you to know what it costs and all of that. We're very transparent about that. But yes, it's privately paid.
And do you have to have a certain number of ADLs in order to?
No, nope, so when you come in, you can need nothing from us. You can just want, I'm tired of cooking and cleaning and I'm not doing my laundry anymore.
And shoveling.
So, and shoveling, like I tell my kids, if they
I
can't
wanna
find me,
live
you know where I am.
am.
Share a room together.
Yeah, no. I have residents that are totally independent.
They still drive, they have their cars there.
They still drive, they come and go as they please, they need nothing from me, except an easier way of living. They're retired of the house maintenance. And then, when they need something from us, then they have it right there where they are.
And some of the assisted livings, there are, what, a couple hundred in the marketplace in Massachusetts, right? Some of them, there is a buy-in fee, right?
There is.
Yeah, so
So
again,
some-
check the different assisted
Some of your
livings.
traditional independent livings that are traditional independent, there's a big buy-in. We are not a buy-in community. We do have a one-time fee that's equal to 1 month's rent when you enter into the community versus like a couple of $100,000, which what a buy-in would be. So we're different in that way. And it's a month-to-month lease. You're not committing to us for years and years, which is really nice. And I think when my seniors come in, it gives them a sense of relief to know that, oh my gosh, when I sign this dotted line, like I'm committed to you for my lifetime. It's not how it works. It's a senior living community with seniors apartments.
Different kinds of senior living options, that's the thing.
100%.
Like you said, buy-in.
Yep.
There are so many, and that's why you really have to explore. Go see 3. I always say 3 is the magic number. You will walk into one, you'll be like, well, this is not for me. And then you go into another, maybe. And then you walk into that one and you will walk out and you'll say, I could see myself here. Or if you're looking for someone else, I could see my aunt, my friend, my mother here. When that feeling comes, that it's telling you that that's the place. That's what I always tell my families that come to visit with me. You'll know it.
You mentioned something about the spend down period. Can you talk about that?
The spend down is really about, what you have in savings before you can qualify
Right.
for Mass Health. I am not a Mass Health expert. That's not really my wheelhouse. But I know that you want to spend down, there's a certain amount.
Right.
So what we would do when you're with us, when you get to about 3 months, when you get down to a certain number, that's when we're gonna start sending you as a family, I may call Lynn and I may say, Lynn, I've got this great family. I said, I'm gonna send them over to see you. So, and then that's when you would be looking for something like that. So, but I always say, that can be very confusing. You want to think about where you are right now, because unfortunately we don't know what's going to happen tomorrow or in 5 years. It's really about living your best life right now, and that's what I say. We can worry about 5 years from now, but nobody knows. So right now I say focus on what you need at this moment and what's going to keep you healthy and safe, and it's going to allow you to live your best life.
Great. Other questions that anyone has for Melissa? No? And I recommend go meet with her, go for lunch.
And a nice glass of wine.
That's really good. So at this point in time, we're going to end with hospice, and which is kind of the progression of life, right? And I think we've all used hospice professionally and personally, and more and more people should really think about it when their loved one is on that road, unfortunately, because it's so important not only for the loved one, but for the family members too. So,
And there's no greater compliment than when your coworkers, yes, professionally, they all, like, Melissa, we go into their building. We provide hospice and palliative care to folks that live there. Lynn, same thing with the nursing home. We're in Shrewsbury Nursing Home providing care.
and accessible.
And accessible as a home care agency, we go back and forth where they'll have a case that they, refer to us. We sometimes have a patient that needs help, and we'll refer to them. So on a professional level, we all very much respect the care that we all bring to it, our care teams. But on a personal level, I got the phone call. I'm gonna need hospice for my mom.
Yeah.
What do I do? And I was in my dining room, and it was, and I remember it very specifically, and this happens with doctors and a lot of people. That says a lot when people in the industry who know everybody call you and ask you to step up and help out. So with that said, though, we do provide hospice and we do provide palliative care. Hospice is a regulated industry. So like a skilled nursing, there are regulations that you have to follow. And mass.gov and CMS, which is the Centers for Medicare and Medicaid, they do set the rules, and we have to follow them. So at the state level, there's some things, but it's usually the federal level is the highest, and that's what we're following for guidelines. So all hospices have to do a bare minimum of the same work. It includes having a medical director. Under that medical director, you have an RN who case manages the entire patient case. Their team consists of social work, spiritual care, home health aides, and then and bereavement, which has to stay. Not that you have to use it, but they have to be involved for up to 13 months after the passing of the loved one, because you're going to have the 1-year anniversary of everything in 13 months. So we want to be there as each thing happens. We also have volunteers, and that's actually regulated, believe it or not. So it sounds like volunteers would just be a great thing to have. Hospices, and we're getting back to it because during COVID, and I hate that we keep using that, but it stopped. We didn't want people in buildings that would potentially, fall ill. But it is 5% of your patient ratio. So if you have 80 patients, you need to have at least 5% of that. You do the numbers with that percentage, and that's how many volunteers you have to have. And I'll tell you that is really, really important, because they are the silent champions in hospice that people don't really even think about, because they're thinking like medication. They're thinking disease, what's going on that brought them to hospice. But having these other things are really, really helpful for your loved one to get even more support. Ours is a nonprofit. We choose to have music and massage therapy provided to our patients. And again, these are therapists who have licensed therapy licenses and masters, and they're not just coming in and playing your favorite song. They're actually coming in and working with families depending on where you are in the journey. Sometimes it's this life review, thinking about Christmases of past and wanting to share those memories. Maybe it's even them creating a song with you. At end of life, it could be coming in and sitting bedside and playing music that matches the breathing of the patient, for the calmness, for the anxiety, because it's very traumatic for us, and sometimes it's traumatic for the person going through it, and so keeping somebody nice and calm. So those are the things that we offer. Most hospices, just like the nursing home industry right now, are owned out of corporations, Pennsylvania, New York, and New Jersey. Back when hospice really kind of got its kick was in the 70s, and it was really built around cancer patients at that time. It's no longer just a cancer patient. I mean, and it really wasn't set up for that, but that's what it was utilized for. It is for COPD, it is for heart failure, it is for Alzheimer's, dementia, it is for a multitude of those things, strokes, anything that brings you into what they would call end stage. And a lot of people, it's very, very scary, because they think end of life, and end stage isn't end of life. End stage means you are no longer, if you look forward 6 months or more, would you be surprised if this person were with us? You can be on our hospice for 2 years, 3 years. If you are, everybody is different, So it's not a black and a white and a cut and dry. So it's really good to know these things, because you don't think you even should be thinking about it until it's too late. when you're in crisis, you know, that last thing, and now you're in crisis and you call in hospice, and they really didn't have an opportunity to put all these things in place. And again, are they even gonna put all these things in place, because they're not all alike. So just like if you were to have somebody, you know, contract to come to do your kitchen, would you just take the first one that you looked up on Facebook or Google or, you know, whatever? That's why Angie's List was created, right? You look at reviews, you talk to your neighbors, your friends, your loved ones, your doctor, anybody you trust. Most everybody at a certain age knows enough people that have been through stuff, you know? And just ask around, ask around, ask around. Go on to mass.gov, go on to your websites, take a look. The nonprofits are typically just that. Nonprofits mean they have a mission. And the mission isn't to make a lot of money, because you actually get in trouble if you make too much money. The mission is to provide as much quality care as possible. And again, back to the 70s, the for-profits were non-existent. It was mission-driven. It was mostly like churches. They were usually faith-based organizations, or they were through hospice houses that would get created off of hospitals, things like that. And now, less than 2% in the country are actually attached to a long-term care. Less than 20% of hospices in this country are nonprofit. And out of the 400 hospices that had any kind of bad outcomes, where the surveys were showing over and over bad outcomes, 300 change were due to nonprofits that were owned corporately, that were doing some things that were not above board.
Compliance.
And there are a lot of loopholes, because the rules were made back when hospice was started. And we all know, just like with any business, because we think it's our loved one and they're passing, we're not thinking it's a business, but it is a business, and I was shocked to find that out when I came to it. Shocked. I thought everybody cared. That is not the case, and it's really sad, and it's really disappointing. So look to see, and again, you never think you're gonna need it. God forbid you don't want it, you know, and so we'll look the other way. There's nothing worse than being in crisis and not knowing which way to turn, and being up against a wall, and you feel like you just do whatever they tell you to do because you have no idea. So if you could think about it and do a little bit ahead of time, but the eligibility, like I said, it scares people, and even doctors will not necessarily refer to hospice a lot of times. Obviously, if you have a cancer diagnosis that's pretty significant, everyone goes, oh, hospice, and it's talked about, right? If you've got heart failure or COPD and you're just struggling, you may be in a 6-month trajectory and not even know it, you know? And some people, when you get hospice in, they actually, stabilize a little bit. And then you thought what was gonna be 6 months turns into a year, because now they're getting this volunteer who comes and sits by, plays cards. You get, somebody who's coming in and giving, watching maybe their favorite soap opera with them. Because caregivers, it's hard to sit and watch a soap opera with somebody when you've got to do the dish, you got to get to, you've got all this stuff, and it's a lot of work. Hospice does not do 24/7 care. And again, every hospice is different. The minimum is that a nurse comes to see you once every 14 days. We never, ever admit a patient without they have the admission, a follow-up the very next day, and then you're seeing a minimum of twice a week. 3 times a week is typical for a home patient, twice in a nursing home. Unless this person's got a lot of symptom management, we're gonna be there every day until that symptom management either goes away or the patient passes, if it's something like that. Same with our home health aides. We never do less unless the patient does, a lot of times people, if they've got family, they don't want people coming in. But if they need the help for showers, for eating, for bedside, changing the bed, cleaning the sheets, making sure that they're groomed, because you're here, your man gets a nice shave, that you have your dignity, they will come in 2 to 3 times a week. And our home patients, we have a lot of patients 5 days a week, which is unheard of in this industry, and I tell you, unheard of. I experienced hospice only in the last week of life, or 2 weeks of life, and it was, I don't know, it was, I mean, thank God, we had a nurse to be able to do the symptom management. But again, not all are alike. So there's that minimum. You only have to do a minimum of work, and a lot of people will only do the minimum of work. a big red flag is that they only take care of people in a nursing home. Because it's easier, you put somebody in the building and then they can just hit all their patients. They're not driving to 44 towns like we are, you know, things like that. So those things, those are red flags, things to look at. I do want to mention though, what's very confusing to people right now is the word palliative care that's being used. And people used to use that when they talked about hospice, but palliative care is going to be in the future. It's on fire right now, it's the Wild West. Insurance companies, Medicare, Medicaid, they typically don't reimburse for palliative care, technically. But we're working on it. People are trying to find these programs because there's a place between the fall in the hospital and the rehab, PT/OT, and hospice. They don't always go right down the line. Sometimes there's some time in between. Things aren't great, but they're not nursing home or hospice bad, but they're not safe or they're not working and we don't know what to do. So palliative care is an option. It's to, and again, for every palliative care program you'll hear about, it's gonna be different. So ask questions because they'll say, oh, palliative care. A lot of them, it's a bridge to hospice. It's just a safety net so that you don't hopefully go to the hospital and then hospice, that they're kind of checking in with you and, you know, just to see how you're progressing. Ours in particular is run by an NP and a DNP, which is a doctor of nurse practitioner. And they go to the home, they meet with the family, they talk to you about things because things are going a little south. Again, may not be hospice, it may be hospice, but you're not going there. You're getting treatments, you're fighting, you got a wedding you want to go to, there's a Christmas you're going to make, you're going to make it to your this birthday or that holiday. So they will find out what the goals are and then talk frankly with you about the reality and the realistic options you may have to make decisions around. So, you know, they can come in and kind of say, plan A, it all goes the way you want it to. Plan B, maybe this happens, that happens, what do you think you'd want to do? Plan C, it all went to hell in a handbasket, you know, that kind of, and what are we going to do? Because we want everybody on the same page. We don't want the family to be, you know, in trauma. So palliative care is a really great thing. But then, you know, I'm talking how great it is. The palliative care program you call up, you may get an RN that just kind of touches base with you on the phone every couple of weeks or once a month or every 2 months. So not all programs are alike and they're not regulated the way hospice is. So again, you kind of have to take a look at, you know, and most, I think they said 60 or 70% of all palliative care programs are attached. Actually, it's 50-50. 50% are attached pretty much to a hospital and 50 are attached to a hospice. So your inpatient palliative care are there for people who are in the hospital to sort of like help that family out if you want to have a consultation. And then hospices usually. So look at what that hospice is about. If the hospice is kind of sketchy, so is the palliative care. I mean, it goes hand in hand. You know, it's the same people running it, and it's the same mission. So you really have to look at, you know, the quality, because palliative care right now is not really funded, so there's no money in it. It's really, you know, a strange thing. You have a question? Oh, okay, I think Money had a question. Yes, I find that strange. So I think when you know that, and I don't feel bad talking that way, because I always, like, this was all a shock to me, because I really did think everybody just did this because it was a calling. You know, I just didn't know, and then when I, you know, got into hospice and started learning all this, it was just a shock. But yeah, it's driven. It's a business. Hospitals are a business.
Absolutely.
Everybody has, you know, that's got stuff on their plate. So advocate for yourself, educate those around you.
I mean, if you're taking your loved one to, say, a neurologist or something, would a neurologist bring up something like that?
You would hope so.
Yeah.
But again, because no two are alike, this is a very new world. And so this is why advocacy is so important, because a lot of doctors, they aren't even aware. You know, our program's only like a year and a half. We started, we only had like 2 patients, then 12 patients. We've served
palliative, right?
on the palliative. We've served 150 patients, and now we have a whole year and a half, and we have goals and outcomes. So, you know, but again, they're all different. So whether you're saying to somebody, your doctor, I really think we should consider hospice, and I was, oh, no. Or you say, I really think we should consider palliative care. You have the right right? And if there's pushback, you can call a place and say, could you call my doctor and ask, for an order? All they have to do is give us permission, which is called an order. It's like getting permission for physical therapy. It's like getting,
Right.
you can ask for physical therapy anytime you want. They can say no, insurance can deny it, but you can ask.
I think, we're always in summary of what we've all spoken about today is that you have options and be an advocate for yourself or your loved one. Or if you can't be, make sure that you have someone in a healthcare proxy, an updated healthcare proxy, and that person can make choices for you and advocate for your needs, which is important. So, those days are gone where there were generations, my mom's generation was that what the doctor said, you never questioned. Those days are gone. You question everything now,
Yeah.
And you have, again, advocate for yourself and options. And we're so lucky that we're in the state that we are, that we have so many assisted livings, PACE programs, nursing centers, hospice companies, home care, Medicare certified and private, where you don't have that in other states, and you've got a
And
great.
Massachusetts is pretty strict.
Yeah, they're
They're
one of the
pretty strict
strictest
about that.
states,
Yeah.
most regulated state in the
Yeah,
country.
yeah, they are,
Yeah.
and so,
Yeah.
but,
Yeah.
even with that, we all know the reality of
Right.
the world we live in and the healthcare system and the Medicare and Medicaid and what,
Mm-hmm.
so, it's, no matter how hard you try,
Right.
things, there are gonna be times that things don't work out.
Right.
And it's always good to have 2 or 3 options.
Right.
That plan A, I always say, plan A, B, and C.
And
And
it's
be-
okay
yeah.
to call somebody
Yeah,
and say,
resources.
I don't really know what you do, but
Do.
I really wanna learn more.
Yeah.
I get that all the time.
Yeah, and you have a great outreach person, Renee,
Yeah, you
here,
guys have-
I
this
must
is a
say,
great senior
very,
center.
great senior center, great active outreach, who's very knowledgeable. We speak at a lot of different centers, and there are some that don't even have outreach.
Yeah.
Right.
So you're very
Yeah.
lucky that you have someone that has the knowledge and you have a contact person here. And our cards are all, and our information's all up there, so please take them, and, it might be a month and a half from now, and you might say, I need an answer on something, and, give us a call. And again, if we can't answer it for you, we will find someone that can, because we want to be resources for everybody.
And sometimes it's a friend even, it's not even your own family, you just
Right.
happen to,
Right.
you're chatting with someone and they say something and a light bulb goes off. I had this happen at a luncheon, the light bulb, she's telling me all about what she's going through with her mom, and I thought, oh my God, palliative care. Like, you should try that, and see what happens, and because, it's just all the things were lining up, but it was not like, she wasn't like a personal friend, we were just at a luncheon and she's just talking. So you may hear something and you could offer some of your knowledge to somebody who might really not know that there's anything out there.
We thank you for your time today.
thanks
Thank
for
you
coming.
very
Thank
much.
you.
Hopefully it was information and
Yes,
educational for
yeah.
you.
Thank you, ladies and
Thank you.
gentlemen.